All the worries you had when you were admitted to the hospital are disappeared now. You delivered your baby without any serious problem. Now, you are ready to go back home for the first time with your infant. There are some more important things you must know before you start. The fetus which was in your womb is now an infant on your hands. How sweet! Now, the things he needs have changed. A new surrounding for him, isn't that so? On the one hand, you'll feel relieved. The one you carefully protected in your womb has come out now. But on the other hand, you have to think seriously about both new infant and yourself. It's challenging, but it will not be so difficult when you get the support from your husband, your mom and mother-in-law. While doing new duties of your baby, you have to be very careful of your body shape. Do some exercises to make your body change to the position it was. Don't think it's a mess. Get used to it little by little. We set this scene to give you some important hints about your post-maternity period. Be with us.
Kanti, you had been so patient until you delivered the baby. Keep the good patience when you go back home too. Your baby is healthy, isn't he? Midwife will visit you and your baby in a few days. Now you know how to keep the baby correctly, don't you? For 6 months, breast milk only. Remember what we said?
Kanti, did your baby wear the nappy? P2? All okay. Isn't that so? Did he cry when the BCG was given? Everyone does. You got 2 vitamin A capsules, didn't you? One more thing I should say before you leave. See whether you got your baby's growth rate chart.
Got all the instructions from the nurses. You listened to them carefully, didn't you? Thank you all. Post-delivery period exists for about 6 weeks. In this time period, many differences may occur to your body, whatever the delivery method has been done. And also you may face some health issues. In the meantime, you have to look after the newborn baby who is slowly adjusting to the new environment.
So you safely returned home. All good? Even the baby is doing well. The blood is passing a little, isn't it? By 2 or 3 days, the color will shade and then it will stop. But it's not good if it keeps passing in red color. If a stinky gland is passing, that's not good either. If you've got a heartache, or if you feel too tired for no reason, or if you've got breathing problems, please meet your doctor. If you get a fever for 2-3 days after the delivery, that's normal. But if it continues for more days, you should look for the reason.
Miss, our baby drinks milk well. Even my mother taught my wife about the way the baby should be fed. But the problem is my wife doesn't sleep well these days.
These days she's very busy. On the other hand, the baby needs to be fed. She must be suffering of that episcut. And she has to go here and there when the baby pees. So how can she sleep? Every one of you has to help this new mother to do all her work. Otherwise, she may get upset.
My mother makes Kanti's meal. Even I do everything I can. However, I'll try my best. She says she gets a stomachache when she feeds. That's what makes her uncomfortable.
Don't worry, Kanti. That's normal. Your womb has to shrink now. That's why you get this pain. However, I'll come back to see you by 2-3 weeks. If you want anything before that, feel free to call me and inform me.
Now we are presenting another important fact. That is, how to recognize an unhealthy child. If the baby can be breastfed well, if it passes urine or excretes feces normally, and if it cries and moves limbs actively, we can say the baby is healthy. But if the baby stops sucking milk at once, or if it breathes whining or cries weakly, your baby is somehow sick. If his limbs are pale and you feel them weak, if the baby becomes yellow within 10 days after birth, those two are not good symptoms. You should immediately consult an experienced doctor.